All right, we're just going to quickly continue this interview where we're talking about a group of Black and Indian private medical practitioners alleging that they are being unfairly treated by medical aid schemes based on the color of their skin and ethnicity. According to the group, they are exploited and harassed by medical aid schemes. They say one of their biggest struggles is payment for medical aid schemes. The group is also saying that there is a national list, which I've actually got in my hand, with names of Black and Indian practitioners from across the country that is circulated among medical aid schemes, and the names on this list are targeted. So I want to continue and wrap up our interview with Nomaefese Gatsheni, a clinical social worker, and Dr. Donald Gumede, he's the chairperson of the National Healthcare Professional Association. So thank you again for staying on and for talking to us. So we've just, I've got all of this information, Noma, that you've given me here, where you basically are given a list of patients that you're not allowed to see because you would not given any sort of, you were not giving their confidential records to the medical aid. So you've basically been blacklisted. They've been said they can't use you anymore.
Yes.
I mean, this is ridiculous if you think about what's going on. I don't know how this is going. How are you surviving?
It's so sad to mention how we survive, because I'm still sitting to think that how am I going to pay all my bonds? How am I going to take care of my financial needs? And this is not just me. I'm talking about every health practitioner that is Black or Indian. And I'm not disputing that there might be 2% of whites that are getting audited, but it is still an exploitation against us. It is still a bullying against us. Yeah. So most of my colleagues, as I'm talking right now, they are depressed.
Yeah, but I imagine so. I mean, we spoke to the fact that you're hearing of deaths and suicides, and they can't pay bills, and because of this. Now, I need to put it out there that we are inviting the medical aid schemes to come in and respond to this, because it is vitally important. Because the messages I'm seeing right now on social media are people are wanting to get rid of their medical aid schemes. They want to get rid of it. They're saying, we refuse to be a part of this and pay for the medical aid if this is the treatment that they are giving to healthcare practitioners, particularly Black and Indian ones. So we're inviting you to come. We're phoning you right now to come in and explain what's going on here, because it's very difficult to understand that this is allowed. Dr. Gumede, have you also received letters like this?
Yeah, I have. And then I even went there to their offices. You know, they will say we send a patient, which they call probes, to your practice as doctors. That's what they do. Then they said, okay, you said you gave the patient flagell. I'm just giving an example. Then, but the patient got anaerobe, which is the same thing with flagell. But then in the law, which they have, the act, there's something called prescribed minimum benefit. They are not going to pay for that medication that you claimed. It doesn't happen. Whatever you claim, you can ask any doctor. If I claimed, made a claim for 500 rand, to you as a patient, it will come that Dr. Gumede claimed 500 rand. But to me, it will be adjusted according to the prescribed minimum benefit, you see, for those medication. Then I'll end up receiving maybe 300 rand. Then the difference that they took, it goes to the administrators. Because these guys, they are in the business. That's why they are always declaring profits. Where do they get the profits if their clients is the patients? You see, so they get the money from the medical aids and then from the practitioners as well. And this syndicate, it has actually went over even to the specialist. I have cases and cases. I have them.
Yeah.
From the specialist level. But then my issue is this. Who gave the medical aid the right to run a parallel judicial system in South Africa? Why are they above the law and nobody is doing anything about it? Okay. Because you see, if indeed you are all equal before the law, someone must investigate this. And besides, like I said, the minister has the reports, even the competition commissioner, where they blame Discover because they're owning around 70% of the share market.
Yeah.
I mean, now think of it. There is nobody who can come in, and they're colluding with hospitals. Netcare, it goes with them. Mediclinic and Life, it goes with MedScheme. So they've colluded. There's too much collusion in the health industry. Even your medication, you cannot get it if you don't go to their pharmacists. You must go to the pharmacist if you are a patient or not, or you're going to pay more money.
So I'm seeing this letter that Discovery sent to you. This is particularly from Discovery to you. Discovery Health is committed to supporting a robust blah, 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 blah. I'm not even going to go into their PR in this one. We have a responsibility to the members of the schemes we administer to ensure the reimbursement of claims aligned to both legislative and accepted industry requirements. So the questions they ask you are... your practice has an outlier profile with regard to the following: high time codes when compared with your peers. Is this true? When you look at your peers, are you charging more?
Now, that's where exactly my answers were based. That who are my peers? Show me who are these peers. Because that letter is sent to every social worker, every psychiatrist, every psychologist, everyone in this practice received the same letter. Now you start to wonder, who are these colleagues? Who are these peers that they are talking about? To a point that I started to demand that, show me these peers. And he refused to show me the peers.
So they wouldn't give you the proof of this. Again, higher cost per claim when compared with your peers. So there's no proof from the medical aid that you are,
in fact. There's no proof.
Okay. Outlier on risk exposure to in-house schemes.
It means I am the risk to the Discovery because the way I claim. Actually, you know what's happening, how it gets there. You start to see the patients will grow, or your clientele will grow. So you are put on a red flag. Once they pick up that you are growing, you are due for audits.
So what they want you to do now is send this information. And I'm reading, this is on a letterhead on Discovery. So now the information that they want you to send, copy of clinical notes.
Yes.
So this is private confidential notes that if I am sitting and talking to you, they want you to send.
Yeah.
They want copies of your appointment diary in which these consultations were scheduled. So you need to now supply all of the names of those that are scheduled for appointments with you. That's my private information. And the validation of time spent with the members. So you've got to prove that you actually spent that time.
Yes.
And you refuse to send this information.
I refuse to send that information because, first of all, when I contract with the patient, I will inform the patient of their rights to confidentiality. I'll tell the patient whatever is discussed here ends here. Now imagine when it's me, the very same person who's telling the patient this is how it's going to happen, and I'm the first person to consent or to ask the patient a consent to say the medical aid needs your private information. Isn't it contradicting from me as a healthcare provider to tell the patient that?
Yeah. And here is the follow-up. So that, what I read, was on the 20th of March, 2019.
Yes.
Now, after you have sort of sent replies asking more questions and everything you've said to us, they send you a letter on the 26th of April saying Discovery tried to validate claims submitted by your practice. However, these attempts were rendered unsuccessful. With immediate effect, no further claims will be paid to your practice. Neither will we reimburse your Discovery Health patients who pay your practice directly.
Yes.
So they are not allowed to come to you anymore.
Correct.
Yes, and they even send them the letter to say you will not consult with that specific provider.
Yeah, this is...
And that means
it doesn't make any sense
That means
to me.
my career ends there.
Which it would. So this is just Discovery. Is this other medical other medical aids that have done the same to you as well?
Yeah, so far I've got Discovery.
Okay.
But my colleagues are suffering multiple of those medical aids. We're to a point that my colleagues stopped working. And now they were trying to do what they are doing. That's the only thing they know. Guess where they go? They kill themselves.
Okay.
They get depressed.
So let's wrap this up because there's a lot of unanswered questions here and we've got to get the medical aid schemes here as soon as possible. So I've asked you this already, where to from here? And I can't help but ask you again.
The reason why we talk the way we're talking is because there's frustration. And you see, when someone boastfully say to you, I'm going to continue doing wrong, and you'll do nothing about it because I have the capital of 20 billion to take you to court. And like we did, I said we did, it says we'll play this game, it's our game, we know the court system, how it operates. So it's no more about justice. It's about who has the money to control the justice system. Because the simple question, our case was simple. We had said to the courts, please can you clarify what does Act 59 say, section 123, of which it says, if I were to interpret it, if I were to say it quickly, if there's an erroneous claim, it should be within 30 days that they must correct that mistake. And they must inform the practitioner and the patient. The patient is excluded in these cases. The patient doesn't know he will receive a letter that don't go and see Dr. Gumede because we blacklisted him. We don't want him because he's refusing to come and sign acknowledgement of that. And remember, what actually we believe is illegal. Why, if I sign the acknowledgement of debt, you pay me?
Yeah.
I'm no more fraudster now. Quickly, I've transformed. I'm a legal entity. They continue paying you as a practitioner. So where's the deterrent? So it's a money-making scheme. It's not a deterrent. It's in a way to try and frustrate healthcare practitioners to move out of business, so to say.
Yeah.
And which is terrible, to be honest, because most of our colleagues, they are trained in health matters, most of them. Now, if you push them out of the health system, where are they going to go? And that medical aid that you're just having is just a drop in the ocean.
This one here that I'm holding.
GEMS.
Yeah.
The biggest medical aid is Discovery. And Med Scheme.
Of the same list that I'm holding in my hand.
No,
that was...
It will be a different list,
but you're saying... huge list and what. And we give you an undertaking. Even if you were to do a random study and phone any doctor, you ask them if they've never encountered this. Majority of them, they will tell you they have.
All right. We have to leave it here.
Thank you.
But I think we've given you an understanding of the list that we're talking about.
Sure.
I'm holding in my hand now. It's from GEMS Medical Aid that was obviously submitted to their patients and their members, I should say, rather. And it's got a name. It's got this scheme will not pay for claims submitted by these providers. Should you wish to consult any of these providers, you will have to provide directly and then submit the claim to the scheme for a refund, if in fact we will refund you. So this is from the 1st to the 31st of January, and it is an entire list of names, pharmacies, doctors, hospitals, practitioners that they are refusing to pay due to stories that we've just heard here this morning. We'll continue, I promise you we'll continue to give time and airtime, particularly to the medical schemes that have been mentioned in this interview. Nomaefese Gatsheni, who is a private social worker, and Dr. Donald Gumede, who's the chairperson of the National Healthcare Professional Association, talking to us on the program, saying Black and Indian healthcare practitioners are being exploited and harassed by leading medical aid schemes in South Africa. Let's take a break. We'll see you after this.